The Omicron surge continues to pummel healthcare systems across the United States. The number of adult COVID-19 hospitalizations per day is nearing 22,000 now, and the pediatric hospitalization rate has skyrocketed to over 1,000 admissions every day. Over 158,000 people are currently admitted to hospitals in the United States. That is a record number of admissions since the pandemic began. This is the overall situation, but it's deteriorating, particularly across rural America. There, the rate of new infections has exploded over the last week. The numbers have doubled from 2 weeks ago and are still climbing. Rural counties reported over 390,000 new infections last week. That's the largest single-week increase in new cases since the pandemic hit rural America in March of 2020. Although the Omicron variant was initially slower to move into rural parts of the country, many rural counties are now seeing higher rates of infections than metropolitan areas, up 110% over the last week. And in metropolitan counties, the caseload has grown by 60%. Deaths are also on the rise in both rural and metropolitan America. After a slight decline 2 weeks ago, the number of COVID-19 related deaths in rural counties have climbed up to about 20%, with over 2,000 deaths. In metropolitan counties, they're reporting a rise of around 25%, with over 8,400 deaths. Joining me now, our correspondent Susan Tehrani in New York. Susan, as Omicron spreads across the country, experts are now particularly concerned about what is happening in rural areas. What is the situation and how is the surge impacting those parts of the country?
Really a high impact, as you mentioned, Simon, as we're seeing perhaps cases in some parts of urban areas across the country subside, like here in New York and Miami-Dade County. I'll give you some examples. For example, in Tennessee, Oklahoma, Montana, and Wyoming, cases are on the rise above the 400 per day per 100,000 people in these areas. However, vaccination rates among the population, for example, are below 50%. That's one aspect of it. Another aspect of it is, as cases continue to rise, more and more health workers are falling ill to this Omicron variant. Now, despite the fact that perhaps it's more transmissible, it's not as deadly, but it does cause, again, more illness, and more healthcare workers are staying at home. They're being quarantined, and these rural areas do not have the manpower and healthcare workers to come to work. Some of them are coming to work sick. Some of them are not isolating. So those have caused problems as well. And then another aspect of it, again, is the fact that these rural areas, the places that I mentioned for you in Tennessee, Nebraska, Oklahoma, Montana, and Wyoming, while cases are on the rise, for example, in Lewis County, Clay County, Mays County, Stillwater, Bighorn County, the cases are going up, but in the closest hospitals in these counties, the number of ICU beds at the closest hospitals is 0 at these hospitals. So you can imagine why the situation is so dire.
So, Susan, are we expecting any sort of specific response from the administration to the surge in rural areas? I mean, President Biden has been very heavily focused on saying to Americans, get vaccinated, get boosted. Those inoculations are available for all Americans, regardless of where they live. But this surge of the number of infections, is it going to result in an intensity of focus on the part of the administration to battle COVID-19, particularly in those relatively less populous parts of the United States?
I think that's one of the major frustrations really among doctors, nurses, and hospitals is this situation has not been able to be combated, notably in rural areas since the beginning of the pandemic. And the Biden administration has been really hyper-focused on two issues. That's, as you mentioned, vaccines and boosters and nothing else. And what many Midwest healthcare workers are now and systems are turning to, and this is something that they're doing on their own, apart from the Biden administration, they're trying to recruit nurses internationally from the Philippines, Nigeria, India, and Brazil, because they are saying that this will have significant repercussions for healthcare systems across the country, because they simply just do not have enough healthcare workers. Healthcare workers do not, first of all, a lot of them feel motivated to stay in the industry because of the lax healthcare system in the United States and how they're being treated. Some because of the mandates of the Biden administration, they don't want the mandates, and some because they just don't see themselves being supported and they're falling sick, they have to come to work, so on and so forth. While many nurses are leaving the industry, they're also leaving these regions and these rural areas for bigger cities, and they somewhat feel forgotten by this administration and the healthcare industry as well. So that's why we're seeing the healthcare industry really turning to the international community for help, and that's not good news for this administration in any way.
Difficult times for the United States, and worth making the point that President Biden will be holding a press conference at the White House late on Wednesday here in Washington, D.C. Susan Tehrani live for us in New York City today. Thanks very much indeed for that.